All right, so we're here today to go over a case study with you guys. Tell us a little bit about what's going on with you and some of the symptoms that you're having.
So a couple weeks ago, I flew over to Virginia to play in a golf tournament. Straight off of the flight, I started to feel like pretty tight, and throughout the week, it got progressively worse. So I ended up playing the first 2 rounds, but was really kind of just trying to get around the course. Wasn't really feeling enough mobility to swing fully, so especially at the top of the golf swing.
Tell us a little bit about those symptoms. Did the symptoms stay in one place? Did they radiate? Or is it on one side versus another side?
It's pretty much just on the right side, lower back area. It wasn't really radiating anywhere. It was pretty much just staying pretty localized right there. And I notice, especially if I've been sitting in a car or sitting in a plane or sitting in general, right when I get up is when the pain is the worst. And then when I walk around and move around a little bit, it kind of gets a little bit better.
Okay. And do you have more pain in the morning or night, or is it just after being seated for a long time period?
I would say mostly after being seated for a long time, but it's probably it feels a little bit tighter in the morning.
Okay, so the things that bothered are being seated for a long time period, it's on the right side, and you feel it mostly when you are at the top of your swing before you pull through, and you feel like it's limiting or hindering your swing because of the discomfort.
Correct.
Okay, so what we're gonna do next is we're gonna take her through an assessment process and see what we can do to decrease her symptoms.
Okay, go ahead, prop up on your elbows like you're watching TV.
Okay.
How does this feel?
This feels fine.
No pain or anything?
Nope.
Does this feel better, same, or worse in this position?
This feels better.
It does? Okay, so we're gonna hang out here for like 30 seconds, okay?
Okay.
Now what I'm gonna have you do is you're going to press up like this for 15 reps, okay?
Like that?
Yep. And you're gonna stay nice and relaxed in the low back, okay? Good. Good. Back up on the elbows. We're gonna go 3 rounds of this, okay?
Okay.
Yeah, so the most important part when you're doing those is keeping the low back super relaxed and the glutes super relaxed, okay? So every time you're pushing, it's all arms.
Okay.
And just relax midsection. So let's look at your forward bend, okay? Feet together, touch your toes. Better, same, or worse than before?
A little bit better.
Good, come back up. Lean to the right. Better, same, or worse than before?
That's about the same.
About the same? Okay. How's it feel going that way?
This way feels fine.
Okay.
Yeah.
Do 15 reps that way. Good, now lean to the right. Better, same, or worse?
That's better.
It's better, yeah. Like how much better?
Like way better.
Yeah, like big difference?
Yeah.
Good, okay. Those 2 things are gonna be game changers for you on the course because you can do them without any other weights or anything else. The press-ups and the side bends are gonna be really, really important for you. What I want you to do is add it to your warm-up, and then if you're playing and you feel it, that's what I want you to do is either a press-up or the side bend, okay?
Just to the left?
Just to the left.
Got it.
So what I'm trying to do is open up this side, right? So if you do have like a disc injury, let me grab my model. What I'm trying to do is take pressure off of that. And what you're doing, you're also pumping the disc as well, okay? And then you also have pain with flexion. When you're leaning forward, you're also compressing, right? So when you lean forward, it's way easier to do this. You see how the little bubble comes out?
Right.
That's if you have a disc herniation, right? Doesn't necessarily need to be a herniation in order to get that sensation, okay? So when you're pressing up, you're pressing on the opposite side of that disc, so you're pushing all that stuff away. So you're shifting it away from that area, and you're also pumping the disc full of fluids, getting it nutrients. How's that position?
It's a little uncomfortable on the right side.
How's this position?
That's fine.
That's okay? How does that feel?
That actually feels really good.
So we're gonna hang out here for like close to a minute, okay? So what I'm trying to do here again is just open up that area and increase blood flow to those tissues. And it takes about a minute to get the blood flow back in that area. So you remember that area in the disc that was possibly giving you some issues in that model? So what I'm doing here is I'm taking pressure off of that area on the disc. And if there's any irritated nerves that come out of the spine, this takes pressure off of it. So that allows the blood flow to go back to those nerves.
Yeah, it feels way better, but I could tell the first swing felt really good and the second one felt a little bit tighter.
Okay, do these.
Yeah, that was way better.
Like big difference?
Yeah.
So what I'm trying to do is bring awareness in the front of your trunk. Okay, so that way we activate everything in the front of your body and try to relax everything in the back of your body. You know, you felt those muscle spasms. If we can bring that attention of your body into the front of your stomach, it should take some pressure off of that low back. Okay?
Got it.
Arms out just like this. Okay. Now, you're gonna bring this arm down just like that, and you're gonna lean, kind of roll as a unit, and then you're gonna press this hand against this knee as hard as you can. Press, 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 press. Really flex. Good. Now switch sides.
So roll on this side.
Yep.
Press this.
Press, 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 press. Switch. We're gonna go 5, okay? You got it. All right, so what this is doing, it's lifting the skin and mobilizing the little nerves that come from the low back and kind of wrap around your hip. You know how that weird hip sensation you were having?
Right.
Those nerves actually come from the low back and they wrap around just like this and all the way into the front. So sometimes you can get some symptoms into the front.
Right.
Okay, so I'm just tracing along where those nerves are and kind of taking pressure off of those nerves. Bend forward. Good, come back up.
Oh, that's way better.
Yeah. Swing.
Yeah, this is way better.
Good. Better?
Way better.
So the main goal of today's assessment was to figure out motions and exercise to decrease her symptoms that she can utilize when she's on the course to help decrease her pain and keep her out there. So a couple key things that I wanted to go over was where she was having pain was mainly on the right side, and with range of motion it was when she would flex forward, she would rotate this way, or lean to this side. So that gave us an idea of what was going on, and we thought there was a closing mechanism problem. So she felt symptoms on the right side anytime she would lean to the right or lean to the right and flex forward. So a lot of our treatments and things were designed to open that area up. Another thing that coincided with that is she had decreased symptoms when we put her into a Mackenzie prone press-up extension exercise, as well as a lateral side glide. And the lateral side glide is going to be the main thing that she's going to be able to utilize on the course to help knock her symptoms down. And every time she did that, she would notice there was a decrease in pain while she was swinging. Another key thing was we did a slump test on her, and what we found with the slump test is whether it was the right leg, left leg, or both legs, when we increased tension on the entire spinal cord and long tract of the nerves, she would have symptoms. What I want you to imagine is this green band is your spinal cord, and these two red bands are the nerves that go into your legs, the sciatic nerves. So with that slump test, what happened was anytime we put downward tension, whether it was on the right side, the left side, or both sides, it would recreate the symptoms in her back. And then when we decrease tension by either having her look up or flex her foot out, her symptoms would decrease. So this also led us down the pathway that there's a strong neural component to what's going on with her. So the next thing I want to talk about is where she felt pain when we were palpating her or putting pressure on her body. So she felt pain by her low back area, which is the first lumbar, and then into the sacrum, which is the big triangle in your back. She also had some pain along her glute area or hip area along the sciatic nerve. And this is very common when you have an irritated disc situation. So when she was assessed on the course, they found that she had pain in her glute area, and they did a soft tissue treatment. And it didn't do anything to decrease her symptoms. And that also leads me to believe that it wasn't a muscular problem, that it had a neural component. And that coincides with the other findings that we had earlier. So what we found decreased her symptoms were 3 exercises, and these are the exercises that she's going to utilize. The prone press up, the side glide, and the side glide was very beneficial because it opened up the tissue that had discomfort, and it decreased the symptoms in her golf swing immediately. So this is something she can actually use on the course. And then lastly, what we did was an oblique chain dead bug. And that's the one where she was laying on her back, pressing into her leg, firing up her trunk. And what we did here was increase the neural drive or tone to the muscles in the front of her body, which decreased sensation to the muscles of the back of her body. So now what we're going to talk about is attractor states, and why when somebody has back pain, sometimes doing exercises for the front of the body and increasing the neural drive or tone to that area will decrease pain to the other side, the back. And I want you to think of it like this. Your brain can only receive so much information at one time. So the pain in your back is like a loud voice yelling, and that's the signal that's getting through. By increasing the tone to the front of the body, it's creating a voice there that can be louder than the voice in the back. So you have 2 competing voices. It's like 2 people talking to you at the same time, and the person that's talking the loudest is going to get through. So increasing the signals to the front of the body can decrease the signals to the back, in essence, lower your pain.